Disease is caused by yeast. Yeast are round, oval, unicellular fungi which are reproduced by budding. Candida albicans is responsible for 90% of infection in human. Habitat: the normal flora of the upper respiratory tract and the GIT and the female genital system. Lab characteristic morphology. By staining, we find two forms, both gram-positive, are recognized in the clinical material and on culture: spherical to oval budding cells, yeast form or Y form, and elongated filamentous cells. Culture: aerobic, easy cultivated, needed antibiotic chloramphenicol for primary cultivation. Incubation at 37 centigrade for 48 hours. Ordinary agar or blood agar, either creamy to white colonies. The yeast are predominantly Y4, but M form developed in the older cultures. Identification: germ tube grow in serum for 3 hours. It's a test characteristic for the candida. At 37 centigrade, make with film, examine for formation of the filamentous outgrowth of germ tube. Chlamydospore grow in nutritional poor media, corn meal agar, on 24 hours at 28 centigrade. Examine for round sequoia structure chlamydospore. Thrush white adherent patches on buccal mucosa and vagina. Vertigo, yes, candidiasis. Chronic mucocutaneous candidiasis is persistent or recurrent candida infection due to inherited T-cell defect. Autoimmune and endocrine disorder may develop in its recessive form. Diagnosis is based on recurrent unexplained candida infections. Treatment include antifungal drugs and treatment of any endocrine and autoimmune disorder. Deep infection involve lower respiratory tract, urinary tract, septicemia localized in eye, endocardium, meningitis, kidney, bone. Diagnosis: culture, isolation, and identification. Detect antibody in the serum. Detect antigen in the serum by ELISA. Using gas chromatography to detect an arabinitol metabolite of candida in serum positive may indicate systemic infection. Treatment: resist antibiotic as it's mycotic infection, not bacterial infection. Superficial infection treated with tropical, with Buline, nystatin, amphotericin B, imidazole, miconazole, clotrimazole. Systemic infection require intravenous amphotericin B with fluorocytosine. Oral administration of new imidazole like fluconazole may be effective in superficial